Dear ministers, dear medical experts, we've got politics, we have the private sector, we've got the medical professionals here. So I'm very, very happy to have this panel discussion. Perhaps let's start with Minister Sikkut for the introductory remarks. When we talk about revolutionizing healthcare and bridging the digital divide, what is the Estonian perspective, the experience, and also the expectation for the future about this?
First, it's always very comfortable to discuss digitalization, e-solutions in healthcare, but at the same time, I have to admit that all the revolution and digitalization, it's nice, but the challenge is almost never in technology, but how to use it in healthcare provision. We have real nurses, real doctors, and real patients who have to make the adjustment. And if we want to achieve more patient-centeredness, better health outcomes, we need the technology to actually work for the patient outcomes. And this is difficult to achieve, and it actually means you have to test and try. You can, we'll implement technology, we'll change the law, but it's never enough. And I think there's a lot of myths, particularly if we look at outside, I don't know, Western Europe, that digitalization, it means digital skills from patient as well. With e-prescriptions, well, patients just have to go to the pharmacy. Previously, they went with a paper prescription. Now they just have an ID with them.
Somebody had to read that prescription somehow as well. Difficult.
Yeah, the skill needed. but no digital skills from the patient is often needed. And it doesn't lose human contact in healthcare. You can dedicate your human time on patients who actually need you. There are a lot of things that can be automated without the human contact lost. And thirdly, the privacy, the security issues, that health data, it's very sensitive, and rather not digitalize. Maybe something happens, but we consciously have to say that, yes, new risks are involved, but these can be mitigated. It's not an unknown territory, and there are more gained from digital data that the risks we take. And honestly, personally, I can't understand why people post the pictures of their children online, but opt out from electronic medical record or refuse to discuss their health conditions with, I don't know, the nurse instead of family doctor. So what is so sensitive about it? It's partly like myth or something we are afraid that it almost never realizes. And since 1/5 of Estonian adult population has their genome data, and it was made available through online portal in July, I believe, we also thought that, a lot of anxiety we might receive, and people want to consult their doctor, family physician, but nothing really happens. So my diabetes risk is higher than average, cardiac disease risk lower, my caffeine metabolism is normal, and if you look at the pharmacogenomics, I should be careful with using warfarin, the anticoagulant. But you can know it. It's just genetic risk. It's not something that has to be kept secret or something that is dangerous. Rather, if I know it, my family doctor knows it, we can use the information to make better decisions in terms of my healthcare if I need anticoagulants one day.
And if you mentioned the privacy aspect in Estonia as well, where in the health portal you have this ability to block access to certain parts of data if you so choose for specific doctors, right? So even if I get a diagnosis from one doctor that I am schizophrenic and 50% of me disagree with that diagnosis, then I could block that access to that entry, right?
You can see who has access to your data, and you can turn off prescriptions, diagnosis, and my hypothesis is, yes, mental health conditions, maybe HIV, information about, I don't know, abortions. This is something that people want to, hold on to themselves, but it's not objective reason. it's involved with stigma. This is what in a society, these are decisions or diagnoses that we stigmatize. So if we work on societal level on accepting diagnosis, really, then there's no need for you to turn the data off from healthcare service providers. But as long as we can't discuss these issues freely in a society, I think in order to build trust towards digital solution, it's necessary. The patient owns the data, and it's his or her decision who he or she shares it with.
I suppose the topic of stigma brings us back to the dichotomy between technological revolution but human evolution, that just our own behaviorals will adapt to those solutions more slowly than other way around. Perhaps we can shed some more light on the situation of Spain, also widening the scope for Europe. You mentioned Western Europe as well. Can you share us more about what the situation is in Madrid in particular?
Okay, I don't know if we have the slides or I go...
Oh, yeah.
Yes, they are here. You can, I think you already skipped one.
Okay, we skip one.
Yes.
Fine. I am in charge of all, one of the things I'm in charge as a regional minister, in charge of all the digital affairs within the region. That means that one of the biggest efforts I am doing is the healthcare sector. So, well, you can see in that slide, the 3 pillars we have. One is the digital administration, the second one is digital society, as you said before, and the last one is digital economy. So, regarding healthcare, Madrid region has 35 hospitals, big hospitals. 4 of them are over 1,000 beds. We have 424 primary care centers, and those are the figures for more than 46.5 million appointments in health in general in primary care facilities, over 500,000 different appointments in hospitals, and surgical. We have interactions. We have more than mainly for 500,000. So it's really a big the amount we are doing. And what we have done, we have used the technology and the utilization of all the model in order to be able to cope with our growth. Each year in Madrid region, we have 120,000 people, new people that come mainly from South America and other regions in Spain. That is going to stress our system. So what we do, we are using the digitalization of all the healthcare department as a Trojan horse. In order, because you can't go to change all the big healthcare department frontally, because we have in front of us 105,000 people. So it's really difficult. So we have to try to start using technology from down up in order to change it. We started working in the post-COVID period, because we had to grant people with the COVID certification, or COVID vaccine certification, and that was the beginning of everything. We create a unified repository of all the people, the 7 million people that live in Madrid, and then we work with the different processes, the different clinical pathways we have, in order that we can simplify for our professionals, also for our citizens or patients. It was really important because using technology, we've seen that for the last years, we have kidnapped our professionals using the technology, because it's really difficult for them to do what you said before, is try to speak with the patients, and that empathy with the patients, it was really difficult. The third thing we did was we're working a regional perspective, creating a workstation for our clinicians. It depends on which service they worked, and they can see all the itinerary for the patients that they have enrolled in each services, and that was the thing we are working now. Also, we create the way that we manage with the citizens was really a physical way, but in the post-pandemic period, we create the virtual health card. It's a mobile phone application. It's a super app. It's considered a super app nowadays. And because one of the problems we had is mainly that in the primary care facilities, we have each year 55 million appointments. That is huge, because if we have a population of, say, 7 million people and 55 or 45, we said also before, million appointments, is 8 appointments per person in the country. And that is in the region, so that is really difficult to manage. We create, well, we see it afterwards, and then we create one of the biggest healthcare data lakes in Europe in order that we can provide new services from that information we have of our patients. The next thing, well, this is the super app we have. We have mainly the information part, then also all the services related to the primary care facilities and also the hospital ones. They are using each day, well, in a regular way, they are using it 3.5 million people. And we aim to achieve 5 million. That is mainly the population we have to attend, because the under 16 they have to go through the parents, and over 67 or 70 people, 78 years they go. The family is the one that helps our older people. And that's what we've done. We've used digitalization. We are working on it. We are trying to change all our healthcare sector in using technology. And because this is one of the most innovative worlds is the healthcare sector. I think that is a good tool that we've put in place for all of them, for citizens and for also professionals. Thank you.
I think this is terribly interesting. And before we move on, I will take a tiny bit of moderator's prerogative. I'm doing my PhD on interoperability and sort of digital transformation right now, looking at both unitary states and federal states. This brings me to the question, how is the collaboration with the other regions in Spain going, and where do you see is there a greater awareness these days for interoperability between the different regions, or are there still a lot of hurdles? How would you describe the situation?
I tell you, the model we have is we interpret using the state node, all the different regions, and then the state nodes goes to the European level. So we are interpreting. We interpret with any system that uses the European node.
Awesome.
So we are interpreting, yes.
And if I'm not mistaken, you can use Estonian eID cards today already to activate digital prescriptions in Spain as well.
In Spain, is it Portugal?
Yes, if it's
Finland,
Portugal, we Spain, Portugal, Croatia, also Estonia, and there are some Luxembourg, and there are other countries.
It's exciting stuff, but it still shows that a lot of these things must be initiated sort of on a case-by-case, solution-by-solution basis. So there's plenty of work, but also plenty of promising work that's already been done. Dr. Ahmadi, you are, of course, a medical AI expert. How do you view the developments in this space, especially from an AI side, of course?
Firstly, thanks for having me here, because it's good to see that industry and private sector is being progressively more recognized as a contributor to these fields. So I believe that digital health at a global scale is the future because of its fluidity and connectivity that it brings. However, the way the infrastructure currently is built does not easily allow for that. Usually hospitals, institutions, even academia centers, these are like isolated silos that operate in isolation. And it makes it difficult for integration of new kinds of technology, life-saving technology, technology that can actually save a lot of money for the institution or for the government and so whatnot, to be integrated into the system. It also makes development a little bit difficult, which is a topic I can go further in. However, I believe to close the digital gap at a global level, it is best to think about it. This global health is a problem that is burdening all of us, so the solution for it also lies with all of us. So in order to accelerate development in that direction, our suggestion is to prioritize open source licensing and allowing data to be shared with what I would call good citizens. We don't need to anonymize data to be shared with everybody, but if there is a structure that allows this kind of data to be shared in an open source manner, so everybody gets to work on it, create new products, develop new things, find new patterns, and raise awareness about them, it can make a massive difference. I give a few examples of how such thing can help while we look at it at a global scale, but it has an impact at individual level. Think about COVID. COVID happened, of course, initially at a local, and then it became a pandemic all across the planet. Later, long time after, when everything was over and people could now sit down and sieve through data offline, they saw patterns of some people who had immunity to it, and then they could look into the genetic data of these people and really trace it back. Things that if data was allowed to be shared initially, it could have saved so many lives. It could have helped so much. Now, when I talk about open sourcing innovation, and when I talk about sharing anonymized data, everybody becomes a little, this is not everybody's cup of tea, because sometimes people think, well, what if it falls into the wrong hands? I really believe that is something with the right governance, one can actually implement it. And my co-founder, Bart, he has really good ideas on that front, how one can actually implement such a system so that development is not falling into the wrong hands. But think about it. As humans, we are seekers of information because we take information from the very young age. As soon as we open our eyes, we want to learn. And we use that learning, that information, to predict the world around us and use it to survive and thrive. Now, I bet this has been the dilemma of all humans, even when they found the first grain of rice. Oh, I found this patch of rice, should I keep it to my family or should I share it with others? I bet there were some who were fiercely guarding it and not sharing it with everybody and just using it for them. And there were others who thought, oh, let me take a step back from this zero-sum mentality and go to the win-win mentality and talk to others and put everybody together, and they became farmers. They started helping the population grow, and I bet that sharing was the seed of what a lot of evolution of human society and revolutions happen. Another example, and then I stop, is think about when Johannes Gutenberg, when he invented printing, he could have just held it to himself and say, okay, I'm going to build a fortune out of this. Yeah, he could have done that, but instead he decided to share that with the world. And I'm sitting here, and we all sit here. All of this development, all of these things that's happening in the world is happening because as children, as teenagers, as adults, we could read books. These are things that people shared, their knowledge. The sharing was underpinning the transformation of human society. We know print made such a massive difference. And to us, and to me, data is like those lead bricks of the print. On its own, it doesn't mean much. It's soulless. There's nothing you can do about it. But if you actually use it and give it to people as tools, use the power of masses to transform this tiny, on its own, not much worth thing into technology, that's how we can then bridge the digital gap. We need to work together. There was this choir this morning, and it had this it really touched me. It had this beautiful sentence in there that all we have is leaning on each other's shoulders and moving forward. And I believe, yes, there will be people who will use it for the bad, but we can do something about it. We shouldn't let fear get into the way of us closing doors and guarding our patch of rice.
I think this feeds very nicely into the remarks of Minister Sikkut about trust versus then fear about how data is being handled. Again, right now, I think many people still have this question about whether health data should even be digital. I'm from Germany, that's a big struggle. So number one, should it be digital at all? And then number two also, oh my God, could this be obfuscated and anonymized, but public? So this is one of those big questions that I think we as number one as national societies, but then also as global society must address. I'd like to come to Roy Shternin, who is both the founder and Chief Patients Officer. My Star Wars fandom would say it should be C3PO, but you're just the CPO. But perhaps you can tell us more about what Chronically does and how this fits into the bigger discussion.
I think that, firstly, thank you so much. I'm super honored to be here. I think that I want to take a step back because I've been a startup founder, I've been in innovation, I've been in healthcare myself. I was unfortunate enough to be on all sides of the patient bed. And I must tell you, the patient side is really not a nice experience. I kind of took a step back and realized that innovation is super important, and digital health is super important, and health IT is the backbone of everything. But we have to remember that there are people on the other side, and that healthcare was created to heal and help people. And this is something that really bothers me, because I've been in a lot of conferences. Everybody's talking about AI in health and trendy stuff, and digital health is so trendy, and people are talking about DIGA now in Germany. But we forget the basic stuff like empathy, compassion, and what it is to be a patient in a system that is not built to help patients. It sounds strange, right? But if you think about it, and you need to be admitted to a hospital, even before any technology that comes around, the human touch will be very effective on the health outcome and on the diagnosis process. In an optimal medical interview, like history taking when a doctor is doing an anamnesia, 70% is the maximum that has been researched that can be achieved from the patient, extracted as information that is crucial for diagnosis. So of course, we need technology, we need decision support system, we need our doctors not to be able or need to click 1,000 times. That's the amount the doctor needs to click in a normal US-based visit. We need to use tools, but we need to remember there are people there. And what Chronically is trying to do is to create a movement that brings patient stories into industry and healthcare and decision-making in order to change it. And that's what I've been trying to do.
I mean, you mentioned some of those things, like everybody mentions AI. A couple of years, blockchain was in healthcare and in mobility and smart cities and everything. So I guess we are in that cycle once again. But if you would think about how to make a patient's journey as empathetic and human-centric as possible, what would you like to see more? And you can draw on your own experience as a patient, perhaps some best practice from around the world as well. We'll be grateful to hear your thoughts.
Absolutely. So I'm absolutely agreeing with the tremendous efforts in Madrid, because it's very impressive. It's not quite often to see that you have one app that does it all, for example. And I must say that I was very touched also backstage with talking to your minister about patient centricity not as an empty phrase. And I think that patient centricity has become kind of, we have greenwashing, right? Right now it's sustainability. I call it blue washing. Everybody's talking about patient centricity, patient empowerment, but very little are doing it. And first and foremost, I think that in the 21st century, if I need to carry a folder with hundreds of paper to the doctor in a country that has the most advanced health IT, I come from Israel, so something is really wrong. So this is the first thing. We need ownership over our data. And when I'm talking about ownership, I'm talking firstly about access. I want to be able to understand what is my patient journey. How come that if I order a pizza from Domino's, I know exactly if the dough is being kneaded, if the cheese is on it, if somebody is taking it with the bike. But in healthcare, I can wait for months to a process or go to a surgery and have no idea what's the outcome of it or what's my prognosis. And I think that technology, when used in the right way, can alleviate this burden from healthcare professionals and allow more humanity in healthcare. And of course, as I mentioned before, decision support tools. There is no human other than a few savants in the world that can remember 32,000, if I'm not mistaken, ICD codes, diagnosis codes. Like, there is no doctor like this. And in my own experience, I've seen in my journey more than 40 doctors before I got diagnosed with a back then rare disease, which is now, due to COVID, is not so rare disease. I have something called POTS syndrome. That is a disruption of the autonomic nervous system. And there is a direct link that has been discovered between some viral infection and these dysregulations. And it's a 5 minutes diagnosis process that every doctor or nurse can do in their office just by taking blood pressure, standing up, lying down, sitting down. But nobody thought about it because there were no decision support tools. And we are dealing with biases in healthcare, we're dealing with biases with AI. But again, for me, the humanity is always the core of things.
Absolutely. Perhaps it would be good for the two ministers on stage to perhaps share not just the past and the recent present, but also the plans for the future. You know, where are we going from here to make sure that the blue washing is not just blue washing, but that actual action is being taken afterwards. Perhaps we start with Estonia and then talk about Madrid.
I'll start with where Roy finished, that in Estonia we are comfortable discussing eHealth, but at the same time we lack patient representation. Yeah, we have good examples from hospitals with patient officers, but no, not systematically. I try to represent patient view since I'm not a medic, but it's not right. We need real patients to be involved in policy making, but this is one aspect that we should change in the future. But in addition to, I don't know, startups, smart e-health solutions, pilot things we test on European scale, we have to discuss the trust and risks involved in using health data. For example, in Estonia, basically everyone has 15 years of electronic medical records. We should use the data. But personally, I was really disappointed when European health data space compromise resulted in opt-out from secondary data use. Germany can be blamed, but opt-out from secondary data use. I own my data, so no one can use my data and come back to diagnose me or prescribe me something. But with anonymized data, synthesized data,
obfuscated
data, it's like a public good. It is used to in research, to develop new pharmaceuticals, new healthcare services, improved patient pathways in order for my children to benefit. And actually, I have no right to say that you can't use my data to improve service for others. Whether in other countries, patients that we have, or patients in the future. And this is very difficult to explain and to agree on international level. So it's very nice that we can exchange patient summaries cross-border, but we should do more with the European patients' data.
I mean, it's a discussion, I suppose, that lives both on an international, but then also on a national level, right? What this reminds me of is this opt-in, opt-out question, where some countries are still getting the decision wrong. I can talk about Germany. I'm not representing the country, thankfully, where recently the e-prescription was made compulsory, but the electronic health record was made opt-in.
Yes, and this, before you made the decision, I had very interesting discussion with German doctors, and I understand everyone likes choice. Everyone wants to give patient a choice, but as I emphasized, the choice has to be honest. You can't you can choose to opt out from electronic health record, but then you have to accept, but in the future, where healthcare is more predictive, preventive and personal, you will be opt-out from the new services. No one will manually digitalize 16 years of my health record, but you don't know what the innovation will bring, but it will use digital data. If you have opt-out, opted out, then it's the choice you make. And if you give this honest choice to most patients, is that choice the same they make with just, do you want to share your data now or don't you?
Yeah.
You have to look at the longer perspective and you have to explain it to the patient.
Yeah, it gets us back to the dichotomy between treatment of private data with the private sector and the public sector. I mean, whenever Beyonce is getting her next child or something, we are happy to click accept all cookies within 2 seconds because we really need to know that news story. But when it's about saving potentially our own children's lives, seems to be a different thing.
No, we share nothing.
Yeah, excellent. What's the situation in Spain? More promising?
Well, what we are doing, we've been doing and working in the empathy with the patients, because all of us will be or have been a patient. So what we are doing is trying to do it easy for them. Many of the things that we've seen, and speaking with the doctors and with patients, is that people want to recover at home from an illness. And we are working, because we have 14,000 beds at hospital, but we are going to try to have the same number of beds at home. So that is really important thing to do. The other one, we are using AI for many things, good things in the healthcare department, and mainly, for example, we have a really nice project with also private-public project, because the technology is private, but we have used it. For our patients is the one we are using in the GP facilities, that we are trying to identify in a quick way or a fast way those symptoms related with rare diseases in pediatric world. That means that when a physician or a pediatric doesn't understand or doesn't see what it could be the diagnosis for that symptoms, we use the biggest, this is called Orphanet, the biggest rare diseases, not only pediatric, but also adult database we have in Europe, in order that with the symptoms, and they can give you the different possible diagnoses, in order that you can launch the pathways, the correct pathways for the patients. That is a really good thing, because you can reduce the time from 2 years to mainly minutes. And that is a really good thing we are doing. Also, we are going, another big project we are doing is with all the information we have from our patients, and for the clinicians, we are trying to scratch all the information in order that find the symptoms, diagnosis, and type of patient, in order that the same thing we've done with rare diseases, do it for all type of diagnosis, for mainly primary care and also emergency facilities. And that is what we are doing. We are trying to simplify everything, and the third part is we are reducing the waiting list. What is really important thing for our patients. And then, as I told you, we are using the healthcare digital card in order that all the information, the patient have all the information of the treatments, of the pathways, and of the different models, as you said before. As you could say, it's a way you can see in which moment the patient is in the pathway or the clinical pathway that he's included.
Yeah.
Wonderful.
So that is what we are doing. We have many things to do, because as I told before, we have to cope with that increase of population, and also the amount of activity our physicians have, and with technology, we are trying to help them on day-to-day basis.
I mean, we see also, this is part of the process of urbanization across the world, that there are fewer and fewer doctors available in the more rural regions. Telemedicine could be one of those stopgaps, but will it actually fulfill the demand of an aging population in most of Europe as well?
Yeah.
We look at the demographic curve, so there's a lot of stuff that's being thrown at us at the moment. Perhaps you could share with us some insights on where you see the technology move, perhaps also what role AI can play, whether it, bearing in mind the security and privacy concerns and everything, is it going to be mostly synthetic data? Do you see any pushes anywhere in the world for the opening up of real data, even if anonymized? Where do you think the world is going with this?
I believe sooner or later, every nation and every person will come to realize we need digital, we need AI in healthcare in order to address all the needs, the healthcare needs. We have an aging population, also because of environmental and many different factors. We have new diseases coming, known and unknown. It's a changing world. And yes, we are moving into that direction. I mean, we are building an ambient assistant for doctors, and there are some countries who would like us to bring it to them, where it acts as an assistant, which means it gives the doctor, it frees up the doctor's time to do exactly that, to be a human connection, empathy, the things that you need a human to deliver to a patient. And you're right, those are very important factors in the outcome of the patient's journey. Now, what they would also do, it means you can use this AI, our ambient AI system that will connect to many, many different AI agents, that each of them do something. When we talk about people, like, say, elderly people in rural areas, there are already solutions out there that there are wearables or there are other things that can take the vitals. And it's not a telemedicine as we know it today. These are new technology that we need to understand. We need to use them in a different way than a telephone in the old telephone consultation, you know. And they will have a lot of power to take the data, analyze, understand, communicate with each other, so that one doctor can then serve a huge number of patients in a very connected way that currently it's impossible. Most people, when they think about AI, it's like how in the olden times when people wanted to build, say, a space shuttle or an airplane, they were building things that would flap its wings because the bird was the closest thing they had seen to flying. We need to understand, we need to think about AI in a different way. We cannot take the traditional ways of doing medicine and ask AI agents to replicate them. That is really, really not using its true power. Yeah, so I think it will help, not just the global health, but at individual levels, for us to become a much healthier society, population as a human, not just physical. We're talking about mental health, physical health, economical health. All of these are connected to each other, to a person's well-being. And AI is there to help us, to support humans to get there.
In Estonia, we are approaching the festive season next month. I've already mentioned in one of the previous panels that the first snow has fallen overnight. Perhaps, Roy, if we can start with you and then come back this way. One small wish for the next couple of years in the area of digital health.
Firstly, I want to see that with every treatment we prescribe also a patient empowerment package. I think that there is an untapped power, not only in the health literacy, but also in the patient education, especially when you use the power of community too. And I've worked on a model called the patient school model that actually takes it all together and try to put it in the same place. Because I really think that there is still the human component of loneliness, and patients need to have a sense of hope, sense of direction, and sense of purpose. And if you just give them a medication and then the pharma is saying, oh, we don't have adherence to this medication, it's because we don't have the purpose of why and how do I take it. Another wish is that patients will be part of the decision-making table. And what really annoys me, also I made this sin when I was a young digital health innovator, is to not ask patients what they need. And we assume, even if we do B2B, we assume that we do it for the doctors or nurses or other healthcare professionals, but it's always B2B2C. There are always patients in the cycle, and we never ask the patients. We never use patient-led innovation or patient insights. Another wish is that every organization that have any interface with patient whatsoever is to have a chief patient officer, or at least a patient in residence. And I've done it also myself in Austria and in Israel in capacities that showed that that can work. Thanks.
All right, we've got a tiny bit of time for the remaining wishes from the panel.
I'll be quick. So my wish is for us to be more patient and loving towards ourselves and not be driven by fear when it comes into deciding how we are going to develop, adopt, deploy, and use this kind of technology. Quick, because fear is the terminator of all good things. This is how the Roman Empire started to crumble. So we need to be careful. Democracy, sharing, being together, using each other's, leaning and trusting each other is more powerful than being frightened of a few. We are bigger than those few. We need to believe in that. My dream, my wish is for us to rise above that fear. That's what I want for Christmas.
Yep. I mean, the key to a good healthcare system is to be patient. That is true. Yes.
Well, what I would like for the future, well, we have different goals we have to achieve. The first one, the ones I've told before. The other ones, this equation is really important, as you said before, is try to involve the researchers. The researchers are really important, and all the, as you said before, so the end of the data we have is bigger if we go to a European level. So we have to try, in this secondary use of data, we have to try to use and to collaborate with other countries, because that would we enrich all what we do. The other thing is also, if you have you say at the beginning, the patient at the middle or the center of everything, we have to go with also healthcare, with social care and education. And that is one of the things I'm trying to do from my perspective and the department I manage, is try to join all the information in order that you have a global view of the citizen. Maybe it's patient or no, but of the citizens. And that is what I'm going to try to do in the following year or a year and a half.
Fingers crossed. Minister Sikkut.
In terms of using digital solutions, I want to say, don't be a patient.
More urgency.
No, yes, because the technology is here. We have to start testing and trying in a way that patients are involved. And it's not just a question of efficiency and the time healthcare workers can dedicate on it. You can achieve equity goals using digital tools. You can make smarter decisions with small steps. And we can actually revolutionize healthcare.
Let's do it. Thank you very much for your time. Thank you for your thoughts. Please put your hands together for the panelists. Thank you.
Thank you.